Hello everyone, my name is Harijs Baranovs and I am a manager in the Latvian office of PricewaterhouseCoopers. My colleague Rihards Gailums and I work in the field of IT consulting. Today we would like to tell you about the work of the PwC team on the European Union granted project with the title European Joint Action to Maximize the Impact of the EU Global Health Strategy. We assisted Paul Stradinch Clinical University Hospital, who is the project partner leading Work Package 5 related to the mapping of key measures and funding of the European Union and its member states in global health, an associated rolling coordination mechanism. The main task of PwC assistance was developing of the technical specification of European Union Global Health IT solution. The goal of European Union Global Health IT solution is made enable the structured collection, alignment and analysis of national and European Union level contribution to global health. We see this goal being achieved through a tool that supports data-driven coordination, transparency and strategic monitoring of the EU Global Health Strategy across EU member states and partners. PwC also understands that the European Union and its member states are at the beginning of this path, as there is no mechanism yet in place for effective cooperation in this area. Therefore, both the IT tool and the cooperation mechanism need to be built in simultaneously. PwC worked very close with Paul Stradinch Clinical University Hospital, and we identified the following objectives to achieve before mentioned goal. First, enable to collect, validate and update data on health-related measures and development assistance in different levels, global, EU and member states level. The EU Global Health IT solution must provide added value to all parties involved in order to succeed in this task. The second, support visual display and analysis of global health-related data through dashboards with charts, maps and thematic reports. This task can be addressed by creating a user-friendly portal where stakeholders can view information of interest at one place that is gathered from various data sources. The third, enhance monitoring of health-related national contributions and their alignment with the EU Global Health Strategy. The main challenge is to agree on mandatory data and indicators that will demonstrate global health impact. The fourth, facilitate coordination, alignment and mutual learning by making visual global health-related contributions and policy documents of member states. A very important factor in this successful implementation of any IT tool is the active participation of the parties involved, clearly defined roles and responsibilities of each party. Very important question for successful implementation is what added value this tool will give. In PwC's view, the EU Global Health IT solution can provide the following added value. First, easy and data-driven oversight of EU member states' alignment with EU Global Health Strategy for EU policymakers. The second, a single portal for collecting, coordinating and providing visibility to national contributions. Data collection would primarily occur automatically from other reliable data sources. The third, open access to standardized and structured global health policy related data for researchers and non-governmental organizations. The fourth, transparent view of health policy actions and public investment for journalists and any person who is interested in health-related data. PwC has identified the following 8 key functions of the EU Global Health IT solution. First, enable automatic data acquisition from external data sources via secure API. Make maximum use of previously collected data so as not to create a new reporting mechanism, imposing additional administrative burden on the EU bodies and EU member states. The second, enable semi-automatic data acquisition via manual structural data upload as alternative approach where API is not yet available. Minimal data upload by responsible persons of EU member states, ensuring maximum convenience for this process. Bulk data loading, use of data structures from other existing reporting mechanisms. The third, validation of collected data using predefined data schemes and vocabularies. It is very important to take care of data quality. Only reliable and high-quality data should be entered into the database. Therefore, we foresee configurable data quality requirements in the IT tool, which are checked at the moment of data retrieval and inform the persons responsible for the database if data deficiencies are detected. The fourth, visualization of data via dashboards, charts, maps, reports, and predefined filters. Information should be presented in the possibly most convenient and understandable way. Data warehouse and dashboards are a very useful solution for this task. The fifth, export of collected data for further analysis outside of EU Global Health IT solution. For those interested in conducting in-depth data analysis, the possibility of easily retrieving data from the EU Global Health IT tool and using it in other IT tools should be provided. The sixth, offer authorized access for users who have tasks related to data acquisition and updating. The seventh, offer public access for researchers, non-governmental organizations, journalists, or anyone interested in this field. And the eighth, log relevant information, system events related to data collection, update, export. Such log files will help later analyze some misbehavior of EU Global Health IT tool or impact of cyber attacks if such happens. The proposed data processing flow demonstrates the sequence of key actions: structuring, collecting, storing, and visualizing. Structuring. PwC proposes to implement structuring via metadata that will describe what data will be stored in the EU Global Health IT solution, from what data sources and in what way this data will be retrieved, what data quality requirements the system will apply to the data, what internal data transformation should be performed on the data. Collecting. Primarily, approach will be data automatically obtaining from external data sources via secure API. Secondary approach could be bulk data manual uploading, for instance, Excel templates. Some web forms could be used for authorized users, for instance, to submit expression of interest from potential aid recipients. Storing. All data will be stored in one canonical database. Required data are described in metadata. New data fields or amendments in predefined data can be configured via metadata. And finally, visualizing. The last step in the flow with a comprehensive functionality to create dashboards and to ensure convenient information search, filtering, and display. Framework consisting of technology, processes, and people must be in place to power any IT solution. In the case of the EU Global Health IT solution, we propose a framework with the following components. The first, a backend information system, front-end website, canonical central database, data mapping and transformation engine, and visualization dashboards as technology components. The second component would be data collection and data validation rules as processes of data processing flow. The third, data governance framework, user roles, access control, and documentation and guidelines as people-related components to describe user involvement and their activities. Since the cooperation mechanism in relation to EU global health strategy is not yet in place, PwC team work with no user stories of EU global health IT solution clearly identified and committed before. Based on our understanding of the potential added value of the solution, PwC can propose some possible user stories for different user groups. Data contributors. For instance, a Ministry of Health official uploads national global health initiatives using predefined templates. A project coordinator from a development agency monitors reported measures and uploads updates. A data validation specialist checks collected data and ensures compliance with validation rules. In case of data analysts and policymakers, we see as the scenario an EU policy officer reviews and compares member state contributions for strategic alignment. An EU officer monitors implementation progress and identifies gaps for coordination. A researcher accesses dashboards to explore thematic or geographic trends in EU global health actions. In case of public users, we see a communication officer downloads aggregated statistics or preparing public outreach materials. EU citizens visits public dashboards to assess EU commitment to global health issues. As the requirements of the coordination mechanism are gradually defined, the user stories may also change and would be updated. And now, Rihards will continue with more technical part of presentation.
PwC team has prepared the structure of the key tables for canonical database. For instance, measure, countries, documents, funding. In this example, you can see structure of the main table, measure. The table should contain such information as human readable title of the measure, country that provides this measure, global health strategy area, like preparedness, equity, sustainability, type of measure, like strategy, law, project, EU level regulation, start and end period, responsible authority, implementing partners, source of funding, like EU, World Health Organization, and funding amount in euros, etc. We have declared automatic data acquisition from external data sources via secure API, making maximum use of previously collected data as one of the key EU global health IT solution functionalities. 5 potential external data sources were identified to fulfill this functionality as well. This is a preliminary list of external data sources. The list could change because it depends on the agreed final list of data fields that must be collected and stored in the database of the EU Global Health IT solution. Here's a short introduction of these options for external data sources. First of all, International Aid Transparency Initiative, AITA. The goal is to ensure that aid and development funding is traceable, accountable, and used effectively to address poverty and crisis. The initiative covers over 105 countries, including Norway and Ukraine. Health is one of the data topics. Next option could be Organization for Economic Cooperation and Development, OECD. The organization works with over 100 countries to promote policies that improve the economic and social well-being of people around the world. The OECD comprises 38 member countries, including the United States, Canada, Germany, France, Japan, Spain, and Norway. Notably, Ukraine is not among the member states. Health as one of the data topics. World Health Organization, WHO, is a United Nations agency that connects nations, partners, and people to promote health, keeps the world safe, and serves the vulnerable, so everyone, everywhere can attain the highest level of health. The organization covers over 150 countries, including Norway and Ukraine. And then 2 European-level data sources. Data.europa.eu is the official portal for European open data managed by Publications Office of the European Union. It serves as a central access point for open data publishing by EU institutions, member states, and international organizations, aiming to promote the reuse of open data and improves its accessibility and value. The portal covers 35 European countries, including Norway and Ukraine. Health as one of the data topics. Eurostat is a statistical office of the European Union responsible for the publishing high-quality, harmonized statistics that enable comparisons between the countries and regions across Europe. Eurostat covers over 40 countries, mostly European, including Ukraine and Norway. And health is as one of the data topics. Starting its work on the project in the spring of 2025, the PwC team focused more on the current paradigm of distributed information systems, which is based on the integration of these information systems and the exchange of predefined data in a system-to-system mode. However, the rapid development of artificial intelligence-based technologies and the expansion of AI capabilities, especially in the second half of 2025, make us very critical of whether the existing paradigm will be competitive with AI-based solutions after 2 and 3 years. The following AI-driven factors should be considered in the nearest future in relation to EU global health IT solution implementation. So first, AI agents will increasingly perform routine mapping, classification, and document extraction. AI-driven automation will pressure EU global health IT solution to accept machine-prepared inputs and to detect more frequent changes and to support near real-time data acquisition and validation. Second, AI agents deployed locally in national information systems will create a more distributed multi-source data ecosystem. As AI agents ecosystem grow, standardized endpoints like MCP style protocols and tools will be required to exchange structured updates and metadata. It means that information systems on national and international level information systems will need to be redesigned and rebuilt to make them AI ready and to open them for wider use. Third, local AI trained with large language models will make it feasible to parse policy documents, laws, strategies, and convert them into structured entries, expanding both scope and workload of EU global health IT solution. More unstructured data will be potential data sources. And fourth, increasing use of AI will require rules, oversight, and special audit trails for AI-generated mappings, document extractions, and automated recommendations. It means that EU and member states will have to pay more attention to put in place new AI-ready governance mechanisms and quality assurance standards. The PwC team thanks for cooperation during the project and wishes successful work and implementation of the EU Global Health IT solution. Thank you.